talked about Integrative Oncology, which is a subspecialty of oncology, talking to patients about how to combine conventional cancer treatments, which are the things we know about like surgery, radiation, chemotherapy, along with complementary therapies, such as things like acupuncture, for example, along with lifestyle changes that patients can do, for example, nutrition, exercise, and stress reduction, and how to combine all of these together in sort of a holistic fashion to help patients with hopefully have better outcomes through their cancer treatment and afterwards.
Just a whole bunch of information, including some new treatments.
So I talked also a lot about some of the sort of interesting high-tech treatments that we do in our practice with 5-day treatments for prostate cancer, breast cancer, short treatments for skin cancer, lung cancer, and a variety of other different cancers using non-invasive techniques, state-of-the-art techniques that basically have incredibly high cancer control rates.
Some of the more interesting ones, of course, like you said, where it's not as invasive, it doesn't leave scars, doesn't require actually surgical procedures where you're cutting into a person.
Right, so one of them was skin cancer, for example, which is the most common cancer around. Basically, we can use a very small little applicator that we can place over the cancer spot after it's been biopsied. We know it's cancer. Basically treating about 5 minutes per session, 2 to 3 sessions a week for 2 or 3 weeks maximum. So 6 total treatments of 5 minutes each, and you get basically a little red, like sunburn-like reaction over wherever part of the body it is that we're trying to treat. And the cure rates for that for most of the common types of skin cancers like basal cell and squamous cell are around 95+%.
One of the things I found really interesting, and I'm sure you've known about it forever, but new information to me, is how much inflammation plays a part in developing cancer.
So I talked a bit about chronic inflammation, sort of differentiating acute short-term inflammation, which we all get when we have an infection or a wound that needs to be healed, and differentiating that with chronic inflammation, which is this long-standing smoldering inflammation due to things like toxins in the environment, not getting enough exercise, being stressed, and these things can have an impact across the body with inflammation, which can cause cancer possibly to develop more commonly, as I showed some data about that, as well as possibly worsening your chances of survival.